At Banner University Medical Center in Phoenix, our trauma and acute care surgery program is built around a simple idea: right care, right place, right time. We have designed this intentionally using standardized pathways, strong communication, and multidisciplinary teams so that care does not depend on individual heroics, and every patient receives consistent, high-quality care every time.
We translate our trauma program's culture and expectations into consistent operations. We have clear processes, defined roles during our trauma activations, so every shift knows what good looks like. We also rely heavily on our PI or performance improvement by reviewing cases, identifying trends, and fixing system gaps. Being intentional is about being present across all shifts, developing leaders not just on day shift, but on nights and weekends. And consistency shouldn't depend on who's working at what time. When expectations are clear, the team feels ownership and reliability follows, and culture becomes visible.
For critically ill trauma patients, high-quality care in real time looks like organized, actionable, and anticipatory care, especially during high acuity moments and transitions. This is enabling us to protect a patient when they're at their most vulnerable. At the bedside, every decision is based on what the patient wants. This involves careful and collaborative communications with the patient's family and with a multidisciplinary team.
Training in our program is unique because it provides structured education, graduated autonomy, without ever compromising on high-quality, patient-centered care. The strength of our program is in the culture, one intentionally grounded in accountability, quality improvement, and multidisciplinary teamwork. Learning is integrated directly into structured clinical workflows, wherein education enhances care rather than competing with it.
I think right care, right place, right time refers to our ability to take patients from everywhere and get the patients that need to be here at this high acuity level on trauma center.
In my role, I provide trauma-informed care for their patients and their families. I help with difficult conversations for what patients want for their recovery or what families expect for their loved ones' care. In this setting, whole person care looks like patient and family meetings with ample opportunity for open discussions with their entire healthcare team, so that we in turn understand the patient and provide the best holistic person-centered care possible.
So what brought me here as a patient, I was serving in the line of duty in the military, and I was hurt. That during that experience, I received multiple different traumas. It was my left side of my body, mostly my leg, my left arm. I sustained a traumatic brain injury. I was then transferred over to Banner Hospital, where they did my first of 18 surgeries. During those 18 surgeries, the seamless level of care that they were able to bring through the vast amount of different doctors was incredible. Through the helicopter ride that saved my life, to the multitude of doctors that were able to make sure I was stable, all the way to the nurses and the physical therapists and occupational therapists that enabled my full recovery.
I think everybody deserves to have great trauma care. The way trauma centers have evolved, they tend to be in metropolitan areas. And so the first key is relationships with these other communities. We've built those relationships and trust over many years through visits to rural communities, to having a policy where if they call, we just say yes. Our mantra when it comes to somebody asking for help, we'll find a bed, we'll find a way to transport that patient here.
Culture, accountability, and collaboration are what make this system work. We have created an environment using strong communication so that our teams can communicate openly. Expectations are clear, and everyone is accountable to each other and to the patient. This is what makes good care reliable care. Looking to the future, we want to use that data to build on this simple idea, where we can strengthen our partnerships and expand more access to our patients so that every patient and more patients can receive the right care in the right place at the right time.
What this hospital provided for me through those levels of care was nothing short of a miracle. What I have explained to others that Banner Hospital has offered me was an entire second life, if you will. The ability that they had to complete my health and to bring back the quality of life that I had in mind was an entirely new additional life. And I am in full gratitude to Banner Hospital for that.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.